joining us. Governor Greg Abbott is requesting public hospitals collect information on immigration status and report costs of care for those living inside the U.S. illegally. The governor says the federal government should pay Texas back for any costs associated with that care. News 3's Morgan Rydell. Here's what experts say might happen.
Immigration lawyer Laura Leone says her initial thought, this order won't just scare away people living in the country illegally.
So let's say there's a family where there's a mixed situation where there's U.S. citizens, there's immigrant members in the family. They're going to have second thoughts to see if they want to seek this medical assistance or not, because they're going to have this fear that if the hospitals are collecting this information instructed by Governor Abbott, will likely be then sent to immigration agencies like ICE to then potentially even start some sort of removal proceeding against the immigrants.
She says current laws protect people from having to reveal immigration status in a healthcare setting, which is why this order could see some pushback before November.
If they're required to give this information, our immigrant community will likely have a fear to even seek medical attention. And in case of an emergency, this could really affect their health.
Institute for Healthcare Access Executive Director Keegan Warren says it could also lead to a decline in preventative care, ultimately leading to more emergencies.
This notion of uncompensated care is that sometimes the things that we might do purportedly to reduce uncompensated care actually increase it. So if, for example, you undermine a community's trust in healthcare, what can happen is that they delay care. And when they delay care or they don't get preventative care, they need much more costly care on the back end.
The executive order will take effect in November, but it emphasizes that a person's immigration status cannot impact the level of care they receive. In studio, Morgan Rydell, News 3.